I'm Dr. Lisa Stout from Cloverleaf Animal Hospital in Lodi, Ohio, and today I'm here to talk to you about the importance of neutering and spaying your cat. My assistant will be asking some questions, so hopefully at the end of this little video, you'll be aware of why we encourage the spay and neutering of cats and how it benefits their well-being overall.
All right. So Dr. Stout, what is cat neutering?
So cat neutering sometimes is an overall term that people just generalize for actually altering a female or male cat. We here say neutering is basically for a male cat as you're removing the reproductive organs of a male cat, which would be both of their testicles.
Okay. And what is spaying a cat?
Spaying of a cat is referred to when you're talking about a female, and it's removing the reproductive organs of a female cat, and that includes both ovaries, the uterus, and a portion of their cervix.
And how does spaying or neutering impact the health and well-being of my cat?
So this is kind of a generalization of a question, and it can get pretty involved. So we'll break it down a little bit between the boys and the girls. So overall, the well-being actually is beneficial for both the males and the female cats. It does help in their overall health as they get older. For females especially, by spaying early on, you are decreasing the chance of developing mammary cancer. For boys, it's more of a behavioral issue to where you're not going to have the roaming behavior, the fighting behavior, aggressiveness. You don't have the strong urine odor that is created when the testosterone levels get pretty high if they stay intact. And so what we typically, also recommend with the females is you don't want a pregnancy, obviously. So we all know that the cat population, there's a unfortunately problem with overpopulation, and there can be several kittens in a litter. So it is beneficial to go ahead and spay and neuter.
And how soon should you bring your cat in to see a veterinarian to get them spayed or neutered?
So here at Cloverleaf Animal Hospital, we usually recommend spaying or neutering your cat between 5 and 6 months of age or later. There are a lot of clinics that will initially do early spay and neuters. A lot of the shelters will be performing early spay and neuters, some as early as 8 weeks of age. We here would prefer if they're between 3.5 to 4 pounds at the lowest range, because there are anesthetic risks involved when they're younger. There has been some research done with male cats being done early if it can contribute to them having urinary issues down the road as far as they get older. So we typically recommend that they are fully vaccinated, usually by the age of 4.5 months. So usually by 5, 6 months of age, they're ready to be spayed or neutered.
Okay. And how will spaying or neutering affect my cat's behavior?
So if your cat is an outdoor kitty, it will definitely lessen their behaviors, intentions to want to roam again. They hopefully will not fight. They won't, hopefully, with that fighting behavior being decreased, not be at risk for bite wounds, abscesses, contracting feline leukemia, FIV, through those bite wounds. It also will decrease urine marking and territorial behaviors. And that goes for inside kitties too. A lot of times if you have an inside kitty, especially the males, again, they have very strong odor. So it does amaze me sometimes when owners come in and they have an intact male, and I'm like, how do you deal with that strong urine in the house? So that definitely lessens once they're neutered. But even if they're indoor kitties and there's outside cats, when they're in heat, there usually is in spring and in the fall. Unfortunately, the inside cats do recognize that behavior on the outside, so you can have behavioral issues occurring inside your house as well if they're intact.
And what are some possible conditions that can be helped or prevented by spaying or neutering my cat?
So the big one for females, it would be pyometra, which that is a term that we use for an infected uterus. They become at a higher risk as they age, and each time they're going through a heat cycle. And so an infected uterus can be what we call, can be closed or open. Both of them are critical situations, but if you have a uterus that is infected and unfortunately ruptures, it's an emergency situation, and unfortunately they can it can be fatal. And the cure for that, or treatment for that, is basically going in and spaying the cat at that time and removing, again, the ovaries, the uterus, and portion of the cervix. But unfortunately at that time it's infected and there's a high risk of sepsis, and like I said, unfortunately it can turn to be fatal. So that's one of the highest problems that we see, again, if they're intact for the females. And again, there's a risk of mammary cancer for the females as well.
Okay, and last question, how should I care for my cat before and after spaying or neutering surgery?
So there's not much care before surgery. Most of the time, right before the night before the surgery, most of the, or at least here, we recommend fasting the animal. So for both your male and female kitties, they're going to be going under anesthetic. So whether that's an injectable anesthetic or gas anesthetic or a combination of both, we don't want them to have any food in their belly, because if in case they do vomit from the anesthesia, pre-med, or even after during recovery, there is a risk of aspirating. And so we definitely want to decrease that potential. So they are fasted before. We usually do recommend leaving the water out so that they stay well hydrated. So that's pretty much basically what we do the night before. Typically here, we do send them home the same day. So the surgeries are done in the morning, and then they're able to go home back to the owner late afternoon, early part of the evening. We always send home a little go home sheet, and they go home with pain medications and appropriate treatments if we do find other things at that time. And usually the recovery time is about 7 to 14 days. The biggest problem that we see post surgery is trying to keep your little kitten or your younger cat quiet and restricted. So that means no jumping on furniture, no jumping off of countertops or cat trees. So it can unfortunately cause some problems with swelling, tissue irritation. It can open up the incision. So it's important for them to be restricted and to follow those guidelines. For the females, because they do have an incision on their abdomen, we do recommend watching every day to just check to make sure that the incision looks okay, that it's not gaping open, they're not licking at it, that there's no redness, swelling, or any drainage from that incision. And if that occurred, we would just ask the owners to call so we could get them back in to look and make sure it's not anything that we have to treat. The males, it's actually quite easy for the males, because with their surgery, there's only 2 small incisions over the scrotum to remove the testicles. And those areas usually scab over within 24 to 48 hours. And so there really is very little to no care with a male kitty after surgery.
Okay, and if there are more questions regarding getting a cat spayed or neutered, what should one do?
So we would love for you to contact us here at Cloverleaf Animal Hospital. You can look us up on the website as well. We do have our information there, or just give us a call and we'd be happy to talk to you more about it.